We will talk about 5 signs of hemorrhoids and its treatment. First, let's define what means hemorrhoids. Hemorrhoids is swollen and inflamed veins inside or around anus. It's rectum, it's anus, and around anus here is inflamed and dilated veins, and inside anus or in the lower part of rectum there is another dilated veins, and they are called hemorrhoids. Hemorrhoids is extremely common condition. It affects 50% of population over 50. So risk of hemorrhoids increase with age. And first and most common symptom of hemorrhoids is bleeding. Bleeding during bowel movements. When person is in toilet, he or she may notice red spots and blood in the toilet bowl, or may notice small bright red blood on the toilet paper. It's common scenarios. So bleeding during bowel movement is common symptom. It's characteristic of internal hemorrhoids. What means internal hemorrhoids? These hemorrhoid nodules or hemorrhoid veins can be inside rectum, as we said, or outside rectum and outside anus. So if it's inside, it is called internal. If it's outside, it is called external. So if there is bleeding, it's usually internal hemorrhoids. And this bleeding usually not painful. So person sees blood but don't feel pain because this bleeding is not painful. Second most common symptom is itching and irritation. Why it happens? Because when person has hemorrhoids, commonly there is discharge, mucus discharge from anus, and this discharge irritates around skin and person has itching sensation. And also this itching is common when there is prolapse or protrude. Protrude means that this hemorrhoid sometimes comes out from anus. Even it's internal, even it's inside rectum here, comes out on the skin of anus. It happens sometimes and it is called prolapse, and prolapse also causes this itching and irritation of skin, and this prolapse is also very sensitive, and it is called protrusion also. Third most common symptom is pain during straining or during bowel movement or prolonged sitting or after using toilet paper. Pain is very common for external hemorrhoids. If these swollen veins are external, outer part of the anus, if it's visible, if person can feel with his hand or can see it, if person will visualize it, it's external. And in case of external hemorrhoid, pain is common, but pain is not common in case of internal hemorrhoids. During internal hemorrhoids, there is some discomfort, some sense of fullness, but not literally pain. And fourth most common symptom is swelling around the anus. If you imagine it's anus, it's rectum, and here is this hemorrhoids. It's an internal hemorrhoid. Here is also another huge hemorrhoid internal, and swelling happens when it prolapsed. This means prolapse. It comes out of anus, and it causes swelling this region here. So person has swollen anus around anus. It's common, and this swollen is soft and it's sensitive when person touches. It's common. And at this case, manual retraction is used. Manual retraction means that when you gently push them back inside anus. So at this case, with person with his hands push this hemorrhoid inside rectum again. So it is called manual retraction. And the most common cause of swelling is external external hemorrhoids or when internal hemorrhoid is prolapsed. And fifth most common cause, most common sign or most common symptom is lump near anus. Here you can imagine it's anus, and here is lump near anus. And this lump, what is this lump? This lump is result of thrombosis or clot formation, and it's painful. Pain intensity is high, and it's sign of external hemorrhoid and external hemorrhoid clot formation, and pain intensity increases over 3 days, and within 3 days it peaks, and after this it decreases intensity because gradually this clot dissolves over time. That's why intensity decreases of pain, but it's painful. So this lump is hard when you touch. Also, it's near anus. We should not lose orientation. It's near anus. Anus is here. Imagine, and here is this lump. It's hard to touch. It's more solid, and also very painful, and it's sign of external hemorrhoids. Now, what causes hemorrhoids? Hemorrhoids can be caused by different causes. For example, chronic constipation, or when person straining chronically during bowel movements, or chronic diarrhea also irritates rectum and can cause hemorrhoids, and obesity and pregnancy and aging and heavy lifting. So if something presses the rectum, anything can cause hemorrhoids. That's the idea of causes. So constipation is most common cause, chronic constipation. So if person has chronic constipation, he or she should remember that later in her life or in his life he will have hemorrhoids in very high probability. And differential diagnosis means that we should when we think about hemorrhoids, we should think about other diseases also. We should exclude other diseases like colorectal cancer, very serious condition, or anal fissures, which are small tears in the anus, which causes pain also. And inflammatory bowel disease also causes bloody stool. So when person sees blood, it does not automatically mean hemorrhoids, but most common cause is hemorrhoids. And skin tags near anus is common and harmless. It's fleshy growth around the anus. It's not problem usually, but it's in most common cases it indicates that person is obese or has insulin resistance, but it's not serious. These fleshy growths are not serious, and it's not problem itself. So now let's say about treatment. Treatment is increased fiber intake. Person should try to intake fiber 35 grams per day. And which food contains fiber? Fruits, vegetables, and grains, and nuts. So increase amount of fruits, vegetables, grains, and whole grains, of course, and nuts. Also, what this fiber is doing, it softens stool and prevents straining. And soaking the anal area in warm water also effective for 15 minutes. It's more effective when person feels pain, for example, because of clot formation. If this pain is too strong, then soaking in warm water can have some alleviating effect. Regular exercise is important for hemorrhoids, and from topical creams, hydrocortisone cream is important because it decreases inflammation, but you should not use it for prolonged period of time because it thins skin and it's important side effect. Lidocaine cream also is it has analgesic effect. It means it decreases pain intensity, so when it's needed it's effective. And witch hazel ointment also effective, or pads, witch hazel pads also what is doing? It shrinks skin and reduces inflammation and improves these hemorrhoids. And fiber supplementation is very important. Fiber supplementation, especially psyllium. Psyllium is very important, and it has very good effect on as a softening tool and for the alleviate constipation and reduce straining and reduce pain because of hemorrhoids. And from oral medications, diosmin, hesperidine, and rutin are commonly used. They can stabilize capillaries and they can increase strength of wall of veins or increase venous tone. So they are effective. Especially diosmin and hesperidine are used in combination. 90% of diosmin and 10% of hesperidine, and totally 1000 milligram per day. And rutin also is used 1000 milligram per day with meal, because of when you intake rutin with meal, it improves absorption. And the intake duration is around 7 days, but sometimes if person has chronic problem and not only acute, sometimes duration can extend up to several weeks and sometimes several months also. And if there is more serious condition, for example prolapse, rubber band ligation is used. Rubber band ligation is very effective procedure, and it's very minimally invasive, and band is ligated on the neck of this hemorrhoid, and it's not difficult procedure, and it is doing without anesthesia, so it's very effective. After several days, this prolapse and this hemorrhoid will removed, and actually it's treatment of mild and small and medium-sized hemorrhoids. So it's very effective treatment. Sclerotherapy is also effective treatment for medium and medium-sized internal hemorrhoids also. And hemorrhoidectomy is last resort. It's last resort for large-sized hemorrhoids, and it's surgery, and it's more complex surgery procedure. And what about external hemorrhoids? In case of external hemorrhoids, usually conservative treatment is enough, and conservative treatment is what we already said above. So in most cases, conservative treatment is enough, and sometimes surgery is needed also if there is clot formation and very severe symptoms. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.